Hello, this is Daniel Gore, your HMIS administrator. Today I will take you on a guided tour of the coordinated entry system as seen in HMIS from the perspective of different homeless service providers. To start, I'm in the system as Open Arms Emergency Shelter. In my scenario, I have a client who is staying in Open Arms for the very first time. I've done a search for the client, and now I'm going to enroll him in the program and check him into the shelter. I've just done my search for Buddy Guy. He appears in the system, fortunately, so I don't have to create a brand new record. I simply click on his name and his information loads. Quickly at a glance, I can see there is some case history here. Again, this client has not stayed at Open Arms before, so there is no Open Arms enrollment yet. You can also see there is no open coordinated entry enrollment. So to start, I will do an intake for our DSS shelter and quickly complete these steps. Since this client already has a record in the system, you'll notice information has already carried over, though as always you want to review for accuracy and completeness. A client may answer or not answer a question when they meet a provider for the first time, but they may choose to answer when they interact with you. One example I want to highlight is veteran status. There have been questions about what this actually means. And if you just go over to the blue question mark just to the right of this question, as well as most other questions, you'll see some additional information. And as you can see here, veteran status here refers to whether or not the person has been on active duty in the U.S. Armed Forces. This does not include reservist or the National Guard unless they were activated. So if someone had served in a foreign army in another country, that does not count. We are specifically talking about active duty in the U.S. Armed Forces. Again, you have those question marks throughout the system to help you answer or clarify for your clients any of these questions. As I proceed, I'll just click through until we get to our enrollment screen where I will select Open Arms Drop-In. For the sake of our demo, I will say this client checked in last night on the 26th. Since this client does have case history in HMIS, you can use the default button where you see it to pull in the last responses given. And that will populate any applicable questions. So for example, in this case, disabling condition was set yes, and you can just leave those answers unless you have any contradictory information or more accurate information to provide. For living situation, I'm answering where the client stayed the night before they stayed in this shelter. So in this case, I will say the client was in a place not meant for habitation. They had been there for a month or more, but less than 90 days. For shelters, we ask you to approximate when that date of homelessness started by asking the client questions related to that episode of homelessness. In this case, the client says their homelessness began last month on the 25th. And regardless of where they stayed last night, how many times or how many episodes of homelessness have they had in the past 3 years? In this case, we'll just say one time, continuous since last month. And the total number of months the client's been homeless is roughly 1. Again, we're measuring in months. it may not be exactly precise, and for clients who are experiencing homelessness for the very first time, you just simply select 1 month. There's a default button for insurance. I will click on that and we'll scroll down and see that Medicaid has been pulled in. I'll click on save. Disability information carried over. We can see that a chronic health condition was identified. You may see also additional text or comments to the right, if any has been provided and shared from previous encounters. I'll pull in the previous responses for domestic violence, and for the sake of our training, I'll breeze through some of these questions that we're familiar with from previous trainings. I'll click default for the financial assessment, and there were some answers that populated over no to both income and non-cash benefits. Now that I've enrolled the client, I'm going to quickly check in that client so that we have that documented stay in our emergency shelter, which is documentation of homelessness. To quickly do this, I'm going to click on check-ins. There's a couple different ways to do this, as this tutorial right here covers. But for the sake of our demo, I'm just going to do a very quick single person check-in into Open Arms drop-in. And again, this person came in last night, so I'm backdating that to yesterday. Clicking save. And that client is now checked in for 1 night. So as you know, a coordinated entry assessor could be any number of shelter workers or outreach workers or even DSS staff across the county. This is a shared program in HMIS, so if you see an open coordinated entry enrollment here, even though it's not from your organization, it's still one that you can interact with. You can add information to that, including a new assessment, which we'll get to in just a moment. But for the sake of the demo, I'm going to change my organization to DSS, and I'll pretend that I'm a DSS worker doing a coordinated entry enrollment. So if I go over to our intake, coordinated entry is available. If you don't have this option available, you're not authorized to be a coordinated entry assessor, and you've likely not completed one of these trainings. So discuss with your administrator if you don't have access to this already or after your training. When I click on coordinated entry, a workflow will begin. And like our previous workflow, this will guide us through the correct screens to get the client enrolled. No new information is required here, so I just click on finish. The household hasn't changed, it's still a single person. Coordinated entry is an option on this list, and it should be the only option. And when you do the enrollment and choose a start date, if this is happening at a shelter or at transitional housing, be sure to change the date to when that client came in to your agency, because we want to make sure that this coordinated entry enrollment is capturing the earliest activity that they've had at your agency. This goes a long way to ensuring that that activity is captured behind the scenes and ensures that their coordinated entry enrollment remains open and active for the duration of their stay in your shelter or in your transitional housing. And it's just good practice. So I will go ahead and change that date to the 26th. Click on Save. Again, information will carry over. So I click on Default Last Assessment. And this form does look slightly different for coordinated entry assessors. There are some specific instructions here. So for example, we're asking, where is a client currently housed? Because in this case, we understand that this is likely happening sometime after the client has entered shelter. So it's worded slightly differently than our shelter entry. In this case, we'll say the client is homeless. They are in emergency shelter. That is a homeless situation. And what's been the length of stay in their current situation, their current homeless situation? And from our earlier assessment, we know that this homelessness started last month. So I'll click on the 1 month or more, but less than 90 days. You may find it helpful to look at these instructions below and see if there's more information quickly at hand. This could include viewing previous shelter episodes. So in this case, I see the one and only episode here at Open Arms, but this would show me if the client has had any previous stays that might change how I answer this and some of the other questions. It's also worth clicking on View Documentation, because from here you may see that, say, a client met with an outreach worker or with another agency, and they were able to provide some documentation of other homelessness that may have happened outside of the county and not captured here in HMIS. So this is very important as well. So once you have a more holistic view of the client's homeless situation, you want to take what is documented and only what's documented to answer the next questions. You want to approximate the date the homelessness started. Again, in this case, it only began last month on the 25th. But if you had, say, that documentation of homelessness in the form of a letter that showed that they were in a shelter in the Bronx since the 1st, you could go back to September 1st. Again, you would only want to do that not based on self-reported information, but what has been provided to you and what's documented and uploaded here in HMIS. Regardless of where they stayed last night, how many times has the client been on the streets or an emergency shelter? Again, based on the information we have, and again, this is coming from our shelter stay, but also from that homeless outreach episode that we saw earlier on the client's dashboard. I'm able to go back to 9/25. The system will give you a nice preview here of the total number of months homeless. So this is going to do a quick calculation based on the number of shelter stays in HMIS as well as the number of outreach contacts in the past 3 years. So to answer this question, how many months homeless has this person been in the past 3 years? If it sees shelter stays, it's going to take all those days, add them up into number of months. If it sees during the course of a month where the client wasn't in shelter, but there was an outreach contact, that outreach contact will count as another month and will be added to the total. In this case, we don't have that situation. We just have the 1 month where all this activities occurred. So I want to take that auto calculation and fill this out. So this is just a nice tip that we've been able to build into the system. Please use it. At this point, there is a disability that's still documented here. As a CE assessor, you will want to take note of that because this may be a vital piece of information when DSS evaluates for housing placement. There may need to be documentation provided as to specific disabilities. So this alone may not be sufficient for whatever the referral and intervention is. So just keep that in mind, that whatever you record here or has been recorded may come up in a conversation with DSS when they're navigating housing options. I'll click Save and Close. Domestic violence, that's still no. The client has not been a victim of domestic violence. And move on to financial. And similar to barriers and disabilities, information here may come in to conversations later when referrals or housing interventions are being discussed. So just keep that in mind. And now we're on to the chat. There is a full training that is being done today on the chat, so I'm not going to attempt to do that here. I'm simply going to show you some of the more technical aspects of the chat here in HMIS and explain what you're seeing. So as it says at the top, the information that you provide here will be used to determine permanent supportive housing and rapid rehousing scores as possible, 2 possible interventions for this client. The assessment date needs to reflect the date of when the assessment was done. You can type in the assessor's name here. That person does need to be a user of HMIS. More than likely you're the person, so just type in your name and it'll populate the rest. Some information will pull in from HMIS data. So we already have the client's age populating. We already know that the client is currently living on the streets. And to clarify what we mean by that, this is looking at any recent outreach contacts. And we know there wasn't a recent outreach contact, so this does say yes. And that and the fact that the client is in shelter, either of those would make this client a yes for the next question, which is, does individual have prior episodes of homelessness? So an outreach contact and their stay in the shelter, which just started, would make this a yes. I'm just going to quickly answer questions that need to be answered on this form. I'm not going to go into, again, how you administer this. That'll be covered elsewhere in the training. I do want to stop and highlight here under employment, if the client is employed, you do have essentially a spreadsheet here where you can add all the client's employment history over the past 24 months. I'd recommend you start with the most recent employer and work your way backwards. Then based on that information, total number of months employed in the last 24 months. And this will auto-populate. The last pay rate will come from the most recent job. Next up is, what is the monthly household income? And to be crystal clear, we're not talking about just the individual's income. So in this case, we are working with a single, so we're talking about just this one person's income. But if you're doing a chat for a family, you want to include everybody's income here on the chat. So you may have just gone through the workflow and assessed 5 family members, 2 of them are adults with income. Take those 2 adults' income and combine it here for your household, your monthly household income. The system won't do that for you, not at this time. So just make notes of each adult's income and record that here. There is some additional information as far as instructions on how you proceed with the rest of this. Stop here if monthly income is below this number, currently $821. And the system is going to set the RRH score to 0. since that would not be likely a very appropriate intervention. Just for the sake of the demo, I will talk some about the RRH questions below. Educational information is pulled in. Rental history is another spreadsheet here where you can enter in the last 24 months rental history. I recommend you start with the most recent residents and work your way backwards. And then total up the number of months housed based on the above. And I'll go ahead and skip over the rest of these because no matter how I answer these questions, the RRH score will be set to 0 based on the previous information. At this point, you see there are 2 scores now being generated, a 5 for PSH, a 0 for RRH. You have an opportunity here to include any notes that you would like or comments that you would like. Knowing that this is an assessment that might be seen by other assessors, that might be seen by DSS, when, the coordinated entry lead in this case, and anyone working on the coordinated entry housing work group. So just keep that in mind. Feel free to include any information you feel was not included here or information that you think others should know. And at that point, click on Save. And there are 2 more steps to go. So at this point, even though we know we just did that assessment, if at this point you have documentation to upload, if your client did have any certificates of homelessness and you were able to attain those, you could upload those here. Income verification, documentation of disability status, etc. If you don't have that information at this time, and again, you may not necessarily need it for every client, unless it's necessary for referral, you can go ahead and just skip this. You can always come back to documents at a later point in time. What you do need to do, however, is record the client's risk for severe illness due to COVID-19. As will be discussed today in the training, the coordinated entry policies and procedures have been amended temporarily due to the health emergency. And this risk status is used in prioritization for different housing interventions. And it's very important that everyone who has a chat, and that's your head of households that you enroll, they have a risk assessment. And that's what we're going to do right now. So click yes, let's enter the risk now. And what we use to do that is a screening tool. Now this is a screening tool that's available to you at any time in the system under the assessments menu. We're not doing a complete assessment right now. So you'll see that there's information here that you would use for clients entering your facility. That's not relevant for the purposes of coordinated entry. What I want to do is just take you down to the required question for assessing risk, which is here under risk assessment. So this will not be auto-populated based on any HMIS data. This is very specific. This is also dynamic and can change based on CDC guidance and recommendations from Westchester County Department of Health. So what you want to do in this case is evaluate everyone in the household. And we understand this is, you are not doing yourself a clinical or medical evaluation, and your trainer will talk more about how you answer these questions. But what you want to do is evaluate everyone in the household because this risk assessment will be used for everyone in that household. So in this case, my single client has COPD. I'll select that from the list. And looking here at our options for risk tier, I need to select one of these options. So my client is not 65 or older, so tier 1 and tier 2 are not applicable. Tier 1 being 65 or older with one or more of those above documented risk factors. Tier 2 being 65 and up, but with none of those risk factors. In Tier 3, under age 65 with one or more. Our client is Tier 3. And because I did select the risk tier, the system is telling me, based on this little red asterisk, that I definitely need to select at least one of these risk factors before I can click on Save, which is what I'll do right now. So we've documented the risk. I will now click Finish, and this will take us back to our dashboard. As a service provider, there are a few things that you need to note when working with clients and how it impacts their status and coordinated entry. For one, if a client is staying in your shelter, you need to ensure to check them in and check them out in a timely fashion. That allows other providers to document stays at their facilities, but it also indicates to the system whether or not the client is still active. If a client doesn't have any shelter stays, outreach contacts, or outreach notes, the client will be auto-exited from the system, typically after 30 days of inactivity. So I do want to show very quickly, since we've already looked at check-ins, I do want to show very quickly how outreach contacts are recorded, since we didn't cover that already. So in this case, I'm going to show you the perspective of choice outreach. So let's say in this case, choice went out and they were able to make contact with Buddy Guy. Let's say he's left the shelter, but he is still experiencing homelessness and Choice is still in contact. By clicking on services, you'll see there's an option here to record an outreach contact. And any outreach team is encouraged to use this. You simply have to have an outreach enrollment that's open, otherwise you can't record this specific service. And it's as simple as that. Additionally, if you're not able during these times to make physical contact and verify the client is experiencing homelessness, we do want outreach teams who are still making attempts. They might be calling the person to record that activity. And through that activity, the client will still remain active and enrolled in coordinated entry. So how do you do that? Outreach teams will go to case notes, click add new. And like I said, this is used in cases where an outreach attempts are being made. This is not used for recording the physical outreach contact where you're able to verify someone's living situation. So in this case, I'll say call attempt. And more or less this works just like any other case note. And you can include whatever information you want in this section. Click Save. And now we have that case note, which again is counting as activity toward coordinated entry. And that client will remain enrolled in coordinated entry from this date forward, at least for 30 days. If there are still attempts being made, that 30-day clock will continue to be pushed out. I just want to show you how you as a shelter or housing provider can quickly check your current roster of clients and what, if any, action you need to take around someone's enrollment into coordinated entry or having an up-to-date chat. So under the housing screen, this is where all the emergency shelters and some of the transitional housing projects record check-in records. And this is often used to do at a quick glance to pull a daily census or nightly census. And what we've included here is the ability to quickly filter any clients based on certain criteria. So for one, if you wanted to see all the clients that were checked into your shelter last night who were not active in coordinated entry, change this to no. Now, drop-in shelters operate slightly differently. Drop-in shelters do not have to enroll every client into coordinated entry or check to see that they're enrolled in coordinated entry. But they do need to see if any of the frequent users of shelter services are staying in their drop-in, because we do want to prioritize those frequent users of shelter services. So that's what this filter is doing. It's looking for anyone who was checked in last night who was not active in coordinated entry, but they are a frequent user, meaning that they've had 14 or more days in shelter in the past year. Additionally, one useful filter to use is by doing a search for anyone who is active in coordinated entry, but who does not have a chat. Sometimes this happens. Again, not everyone in your facility receives their own chat. This is usually just reserved for the heads of household. So I'm going to turn on the filter for heads of household only, those who are active in coordinated entry, and I want to see who does not have a chat. And nobody matches that criteria. Now, if someone did, they would have been displayed here. And as you'll see, there is a button next to everybody that will allow you to quickly select their record so that you can navigate to the appropriate screen where you need to either enroll them into coordinated entry if they need to, or add a new chat if they don't have an active one, and do what you need to do to ensure that those clients are being considered for the appropriate resources and appear on the prioritization list. At this point, I want to show you the coordinated entry system from the perspective of DSS and your housing navigators. So in front of you, you now see the prioritization list. This is what DSS and the coordinated entry team uses to identify clients who may be eligible for various openings, as well as to manage the entire referral and placement process. Just as a quick overview, at the top of the screen, there's the ability for the coordinated entry lead team to filter based on scores. So scores of 5 or more are prioritized over 0 to 4. And there are different ranges for RRH scores, as well as various filters based on the different criteria and considerations for any given housing opening or resource. So, what happened to Buddy Guy? Let's take a look. What I'm going to do is search for a PSH opening, starting with the clients who are the highest scores. So I just did a search of my list, and we now see 2 clients. We see Donald Duck and Buddy Guy. And the coordinated entry team, when they see this, they're reviewing a lot of information here on the screen, but also reviewing notes as well as other information behind this record. As you can see, there's notes that are made, there's eligibility information to consider, etc. We can see that our first client, who is higher priority based on the total number of months homeless has already been referred. There's a referral record here. In this case, it says to DSS. But that client is being referred, and they're on their way to receiving a CoC resource. So for the next up, we have Buddy Guy. He's the only other client who's here on our list. And this person, for the sake of our demo, is eligible for a PSH opening. So what would happen then? Very simply, the client's information would be reviewed in detail, and there would be conversations with the housing provider. Likely documentation would be reviewed, and there might be communication about gathering that documentation. But what I want to show you is what happens in HMIS, and that is a referral being generated by the coordinated entry team at DSS. So I will generate this referral for today for permanent supportive housing. There's a way to narrow down the search to particular organizations. In some cases, there may be openings across multiple providers, say for DCMH rep that operates across many different providers. So I'm just doing a quick search here for PSH, and we'll see in my demo site, I do have a few providers of that housing service, and I will go ahead and select DCMH wrap. A referral can only be made for a client that has an active enrollment in coordinated entry, which this client does. An email will be generated. And what's going to happen is you'll receive that referral notification with instructions, and we'll see what those look like in just a moment. So right now, the outcome of this referral is simply that it's a new referral. There's no other outcome at this time. There's no appointment date. There's no results just yet. When I click on finish, the system will say, here is an email template you're welcome to use. But this can just be used to quickly email the appropriate personnel at the housing provider to let them know that someone is on their way. The process has begun. There may also be additional instructions provided to that housing provider. There might be copied here, say the shelter provider, so that collaboration can begin around collecting required documentation and other information. So obviously a lot of communication happens outside of HMIS, but this is the referral record documenting the beginning of that process. While you don't see the system-wide prioritization list, you do see your clients and activity on their screen. So you would see the referral and you would see the status. Now I'm going to switch gears and show you how this referral looks from the perspective of DCMH, the housing provider. So I'm DCMH now. I've received an email notification telling me that I need to go into HMIS and take a look and acknowledge a referral is coming. You will locate that under the incoming referrals screen. So over here on the home screen, over to the left, incoming referrals, and sorted in order of newest to oldest, you'll see your incoming referrals. So these would be any that are new, those that have been acknowledged but don't yet have a result such as accepted or rejected. So what I'm going to do is click on edit here. I, as a housing provider, want to tell the coordinated entry team that I have acknowledged, or maybe I've accepted, or maybe after that conversation with the client, The client's rejected, or I've rejected the client for various reasons, which are explained in our policies and procedures. So in this case, I'm going to go ahead, not just acknowledge, but I'm going to accept the referral. You can also provide some comments here that you can share up to the coordinated entry team. So this information at the top is coming from the coordinated entry team, and then below here is information that you're asked to provide as far as updates to the status of this referral. I will go ahead and click on save. And because I've made an update, HMIS is saying, let's go ahead and let the person who sent you this referral know about this change. So at this point, we're not including any personally identifiable information here. We do have the client's HMIS ID number, and you can use this window to include any comments, additional information you wish to share with the coordinated entry team. And now you can see that that referral for Buddy Guy is no longer here. This is only showing your incoming referrals. If you're ever curious, you can always find a complete history of your referrals under the provider screen, which is a completely other section of HMIS that you reach by clicking on these blue buttons at the top of the screen. And as the housing provider, of course, if a client's been accepted or admitted into the project, the next thing that you want to do is do an intake as appropriate based on your data collection standards. And so in this case, this is a standard intake being done for DCMH wrap. We do not have a housing move-in date yet, so that will be completed later. Oh, and now we're back onto the client dashboard, and we can see a very clean, not necessarily typical client interaction with the Westchester County coordinated entry system, from their first point of contact with the outreach team to a stay and emergency shelter, to their coordinated entry and chat being recorded, to then their enrollment into a housing provider. Always opportunities outside the workflow to record, say, documents that need to be uploaded, services that need to be tracked, notes that need to be recorded, check-ins to shelter that need to be done. Or additionally, if someone has been in coordinated entry for a very long time, let me go here to assessments and click on chat. You may see that they need to be reassessed. That option that you see right here to add or edit a chat. And it will just take you through that workflow to record that information. If you didn't have the opportunity to record someone's COVID-19 risk, you can do that here as well. And you can always review information that you may have entered. So that concludes this portion of your training today. I hope you enjoy the rest of the training and learn a lot that you can take back to your organization and deliver the best quality care to your clients. Thank you very much.